In this module, we will be trying to understand alcohol use disorders and their management. At the end of this session, you will be able to explain alcohol use disorder and its effects, explain how to assess a patient with alcohol use disorder, describe management of alcohol withdrawal, and discuss management of a patient with alcohol use disorder in primary care. One important issue we should understand about problems related to alcohol use is its magnitude in a community is directly proportional to the average consumption. Therefore, any community measure to reduce alcohol-related problems should aim to reduce average alcohol consumption. In other words, only targeting people who are dependent is not enough. The only effect alcohol has on your brain is the suppression of brain activities. Most of the widely accepted effects of alcohol are actually learned responses. In other words, they're not driven by some innate property of the substance. For example, so-called pleasurable effects occur in experienced drinkers who have frequently associated alcohol intake pleasurable social or personal experiences. Research shows alcohol does not produce pleasure in alcohol naive subjects. The highly subjective quality of various individual responses to alcohol also confirm this. According to the WHO, alcohol is a toxic substance and any amount is harmful to your body. Making recommendations about safe limits is not advisable. Learning to accurately assess someone's alcohol use problem is important in deciding the type of care. Pathological alcohol user is either a dependent person or a harmful user. These individuals need to be further assessed and referred for treatment. When you talk to someone, it is important to understand the complex, interrelated nature of his life conditions and alcohol use. Although people commonly believe that all the problems of the alcohol dependent person are caused by alcohol, this is not true. Some of his problems are caused by alcohol, some aggravated by alcohol, yet some of his life problems drive alcohol use. For example, a person with social anxiety might be using alcohol excessively to curb his anxiety. Also, a person who has had family conflicts might be spending his evenings at the local bar as a means of avoidance. So, when trying to address the alcohol issue of an individual, it is important to approach these complexities in mind. There are a number of areas that need to be looked into when assessing someone with problematic use of alcohol. Although patients might present with the alcohol issue, we should explore other substance issues such as tobacco and cannabis. Then, coexisting medical conditions should be assessed. Then, any personality issues which lead to continuous substance use should be assessed. For example, lack of assertiveness, poor frustration tolerance, and impulse control issues. Then, issues related to his family life and social functions, such as occupation, should be assessed. Sexual health of the person is also important to be assessed since sexual problems can also coexist with substance abuse. A thorough risk assessment, including physical health risk, sexual health risk, and risks to other people, should be carried out. Finally, any unhelpful beliefs held by the patient or family members regarding alcohol that promotes his substance taking behavior should be explored. Let's talk about assessment of alcohol withdrawal. Severe withdrawal symptoms should be expected in anyone who consumes alcohol in large quantities, especially on a daily basis. If you see an adult male with unexplained fits or delirium, always think of alcohol withdrawal as a possibility. Severe withdrawal symptoms such as delirium tremens usually occurs after 48 hours. Withdrawal should always be planned for someone who is dependent on alcohol. Then we should be prepared proactively. Severe dependence, medical and psychiatric comorbidity, poor social support means inpatient detoxification. Otherwise can be managed as an outpatient. Remember, withdrawal fits and delirium tremens could be life-threatening. Benzodiazepines are the main pharmaceutical agents used. Long-acting ones, such as chlordiazepoxide or diazepam, are usually used. Thiamine 100 grams per day should be given, preferably parenterally for the first few days to avoid wernicase encephalopathy. It is important to remember only a few of the patients will come seeking help. Some might come because of a medical complication of an accident related to alcohol. Therefore, it's always good to ask about alcohol consumption whenever you are seeing an adult male. A holistic treatment approach can be divided into four main areas. First, an assessment is done to understand the extent of the alcohol issue and other relevant factors mentioned in previous slides. Then the patient should be detoxified if needed. The treatment should aim to help patients discontinue the use of alcohol and then to remain abstinent. Finally, issues related to the patient's family should be discussed. Clearer picture of this table and other important additional details you will find in the handbook provided. At primary level, when managing an alcohol-dependent patient, first carry out a full assessment according to the template provided in the previous slides. Then detoxification should be planned according to previously mentioned criteria, followed by a basic psychoeducation. Then the patient should be referred to a specialist for specific management. For patients with harmful use of alcohol, the same protocol follows, except they might not need detoxification. Non-pathological occasional users would benefit from a basic psychoeducational approach that includes myths related to alcohol use, effects on the body, and the influence of the industry on individuals and on society. There are several principles a doctor should follow when providing services to someone with an alcohol problem. All the problems and issues in the alcohol dependent person is not due to alcohol alone. Therefore, all the others the patient is going through should be taken into when providing help. Discontinuation of use or a reduction of alcohol use is one of the objectives of the management. But this is not the only objective. The effective treatments that are utilized to reduce alcohol use are sometimes not exactly the measures that are used to help the patient. For example, strategies to address family disharmony. Although patients might not appear very motivated during initial sessions, the treating doctor nevertheless has a duty of care for such patients, because a positive engagement with the treating team can motivate people to take necessary steps towards change. Similarly, as the treating doctor, you also have a responsibility towards family members and other individuals affected by his substance taking behavior. Also, it should be remembered that people with alcohol addiction problems are at a higher risk of developing medical illnesses. A comprehensive assessment should look into this. A plan for detoxification should be done for people with physical dependence. An empathetic, non-confrontational, one-off session that uses principles of motivational intervention can be enough for some patients. There are a number of pharmacological agents that can be used to help patients to remain abstinent. Disulfiram is one of the most effective aversive agents. Patients who believe that they might need some external motivator to strengthen their commitment will improve from this treatment. Acamprosate is an N-methyl D-aspartate receptor modulator which appears to promote a balance between the excitatory and inhibitory neurotransmitters in the brain. Main benefit seems to be the reduction of withdrawal-associated distress. It has a side effect profile and it is not metabolized by the liver. It can be given despite alcohol use and hence administered to patients with hepatitis or liver disease. In trials, it has helped to reduce returning to drink, but not the amount they are used to. It is less efficacious than naltrexone or disulfiram clinically. Naltrexone has the best evidence base to treat alcohol and opioid misuse and dependence. It is an antagonist at the opioid receptor and can block endogenous opioids, which tend to modulate and reinforce the effects of these substances. It also modifies the hypothalamic pituitary adrenal axis to suppress ethanol consumption. The side effects can be abdominal cramps, nausea, diarrhea, signs of autonomic hyperactivity, anxiety, and headache. Effective health education with a focus on motivational intervention techniques is the best psychological approach that can be used by a doctor. It is important to get an understanding about these specific psychotherapies. A detailed discussion on specific treatment strategies is beyond the scope of this book. However, it is a good idea to be enrolled in the multi-sector alcohol prevention program run by the Directorate of Mental Health together with the World Health Organization Country Office and National Authority on Tobacco and Alcohol, which is a 3-day training program for doctors covering each district in Sri Lanka. When you plan a community program to address alcohol issues in your area, please try to follow the principles mentioned in this slide. It will help you to develop an effective and attractive community health education program. The main responsibility to seek treatment and make behavior changes lie within the patient, not others. Alcohol is a central nervous system depressant, not a stimulant. The pleasure and other emotions and most behaviors following alcohol use are learned responses. Therefore, alcohol users should not be given undue privileges or permissions, such as excusing them for behavior in an indecent manner in a party. More than if one drinks alcohol or not, the value one gives alcohol is more important and relevant. For example, the teetotaler's wife of the pathological drinker may insist that they serve free alcohol at the wedding reception of their daughter, although her husband is just recovering from alcohol dependence. Alcohol, even at very low doses, such as one drink a day, causes health harms. Safest level of regular alcohol use is zero. Alcohol use is a major risk factor for development of cancer, especially breast cancer. Alcohol industry wants to recruit new customers as their customers die prematurely. They target young people more for obvious reasons. Product placement coupled with powerful messages in mass media and creative media is a well-known tactic of the alcohol industry. For example, the hero of the movie starts to drink alcohol after the girl leaves him, who then returns hearing that he drinks alcohol because she left him. The industry also manipulates role models in society, such as doctors and lawyers, to promote alcohol among lay people and youth.